Good evening and greetings to one and all. On behalf of the Sports Authority of Goa, it gives me immense warmth and pleasure to welcome you all for today's sports webinar on physiology of strength training. The SAG has been conducting a series of online sports education programs to educate sports professionals during the COVID-19 pandemic. We have conducted over 15 webinars on various topics, and today's webinar is on the topic Physiology of strength training. This topic is chosen keeping in mind the very important role development of strength training plays in the performance of a player. And to guide us on today's program, we have with us Dr. Anjabam Barun Sharma. To introduce Dr. Sharma, he is an exercise and sports medicine specialist as well as a medical and clinical physiologist. After MBBS, he completed post-graduation in sports medicine and medical physiology. He has completed senior residency from MAMC, AIIMS, New Delhi. He has worked as a sports medicine specialist in Sports Authority of India, Impal, and with various sports teams and athletes. He has also been a guest faculty and external examiner of sports exercise medicine and physiology at National Sports University, Impal. He is currently working as a faculty in the Institute of Medicine Sciences, BHU Varanasi, in the Department of Physiology, and is the in charge of Sports, Exercise Medicine and Sciences section, Human Performance, Environmental and Lifestyle Medicine Lab. He is the founding and current president of the Indian Society of Sports and Exercise Medicine, which is the only national level registered apex society by recognized specialists in the field of sports and exercise medicine in the country. He is also a martial arts practitioner, a national and international peer-reviewed and index publications, and has index publications to his credit, and is also an active reviewer as well as in the editorial board of few prominent journals in this field. He has recently been conferred with the Dev Raj Bajaj Research Award 2021. On behalf of the Sports Authority of Goa, I accord you a very, very warm welcome, Doctor, for today's program, and would like to specially thank you for making time out of your busy schedule and agreeing to conduct today's program for us. This program would have also not been possible without the support and guidance of our Executive Director, Sir B.M. Prabhudesai, and our Director Coaching, Sir Bruno Coutinho, who also celebrates his birthday today. We wish, on behalf of the coaching section of the Sports Authority of Goa, we wish him a very, very happy birthday with lots of good health and happiness in the years to come. Once again, a very warm welcome to all for today, and I'm sure today's program will be a great success with your support and cooperation. Before I ask Dr. Sharma to take over, I'd just like to request all our participants that in the end of the program, you will be provided with a feedback form link. If you're watching it on Zoom or on YouTube, in the chat box at the end of the program, there'll be a link provided. Kindly click on the link and submit the form, and your certificates will be sent to you 10 days after verification of attendance. So I now request Dr. Sharma to please take over and start the session.
Thank you very much, madam. I will just wish a very happy birthday to sir. So we will start now. Let me share my screen because lots of things to talk. But yeah, I think is it visible, right? Yeah.
Yes, doctor, it's visible.
Okay, so since this is a webinar series where we basically talk regarding the latest advances also, so I will not be concentrating on the basic stuff because this is not a classroom teaching, and for future classroom teaching we can always do more sessions. So my idea here today is to bombard with you with all the new information, new applied aspect which is going on in the field of sports and exercise science, so that we may be able to apply all the latest advances in the near future. So let's start with the topic of physiology of strength training, and I am Dr. Anjabam Barun Sharma. So let's begin the talk. Where the slide is not changing. Okay, so So first, let's begin with the concept of exercise and sports medicine. Exercise and sports medicine, as we all know, that it has two branches, that is sports medicine and exercise medicine. And the concept, the ultimate aim of sports medicine is just performance optimization. We have to increase the performance with the minimization of the injury. And another branch is exercise medicine, where we use different exercise therapy for different rehabilitation, for the treatment, etc. So for sports medicine and exercise medicine, strength training and exercise training is so much important because they form the basis of everything. So before going into the detail, let's focus on physical fitness. We must know that physical fitness has lots of components. It has different health-related components, skill-related component, where we have to focus on different aspects of the physical fitness. And the purpose of the exercise is itself to increase or maintain our physical fitness. So strength training, if we consider the strength training today, is basically targeting this body composition, muscular strength, muscular endurance, as well as all the skill-related component of the physical fitness. That's why strength training is very much important. But unfortunately, strength training has been neglected so much in the general people also, because they always focus on the cardiorespiratory fitness, running. But apart from the running, we also have strength training, which have tremendous capacity, not only to improve performance, but also for health and fitness. So before going into the details, let's focus on some of the basic exercise physiology. So basic exercise physiology, I would like to focus because the grading of the exercise is very much important. This is for aerobic exercise, but since we are morely concentrating on the strength training, so I will focus here. So in the strength training, the exercise can be divided into very light, moderate, vigorous, or near maximum exercise, depending upon the 1 RM. What do you mean by 1 RM? 1 RM is nothing but one repetition maximum. Everything is given in the name itself. That means one repetition maximum. How many repetition? Only one. And what is the repetition? It should be maximum. That means the person is able to do only one repetition with maximum effort. That is known as 1 RM. That is, suppose if I am able to lift a particular weight only one time with maintaining all the correct posture and form, that is known as 1 RM. That will be my 1 RM. So if my one RM is, suppose, say 100 kg, suppose if my 1 RM is 100 kg, then if I do exercise with less than 30% of that 1 RM, that is 30 kg, then it will become my very light. So in that way, it can be divided, the strength training can be divided into different categories. Knowledge of this is very important, because depending upon what type of the adaptation you require, you have to give exercise. That is known as specificity of training, which you must all be knowing. So this is the basic concept of the strength training. And before going to the basic concept, another important point which many of the people ask is regarding the conversion of the this heart rate maximum, how heart rate maximum can be utilized for exercise grading. Since we must know that there are, depending upon a different energy system which provide the fuel for particular exercise, the exercise can be divided into aerobic or anaerobic zone. And strength training basically comes into this concept where ATP PCR phosphorus system, anaerobic glycolysis is being used. So depending upon your maximum heart rate, your exercising heart rate, if you do exercise at suppose 100% of your maximum heart rate, then it will target mostly the ATP PCR system, which are also known as anaerobic system. And by you, and another important point of this exercise intensity is many of the people, they prescribe exercise intensity depending upon a VO2 max. But unfortunately, VO2 max is a technical stuff, laboratory. So how you are going to convert VO2 max into a heart rate? Because heart rate, you can easily buy a machine from the market, and you can easily prescribe your exercise or do according to that one. So carbonate method is we generally use, where this is the formula where we basically use the percentage of the VO2 max can be converted into percentage of the heart rate. And by using this carbonate method, we will be able to utilize or prescribe a particular exercise. Why this is important? Because warm up has to be done before any strength training or any kind of exercise. We usually do warm up. For example, warm up is generally prescribed at 40 to 60% of VO2 max. So how you are going to convert this into heart rate? And by just using carbonate method, you can easily convert into maximum heart rate, and you can easily do your exercise where maximum heart rate can be estimated at 208 minus 0.7 into A's in years. This is the most frequently used method to 20 minuses, but unfortunately, this is not reliable. So we must keep this in mind. So warm up and a warm down can be prescribed. It has to be prescribed before the strength training, because in order to prevent the injury and in order to increase the adaptability. So by knowing this basic concept, again, let's go to another concept, that is the muscle contraction. This is a muscle contraction is basically what you call, it can be isotonic, isometric, and isokinetic. These are very basic stuff. But what you have to know, that when the muscle is shortening while contracting, that is known as isotonic concentric contraction. If the muscle is lengthening while contraction is going on, that means it is known as eccentric training. Why eccentric training is very important? Because I will be focusing in the later slide. And this is the isokinetic contraction is basically when you do the contraction at a particular angular velocity. It can be done by using isokinetic machine or variable resistant machine, or isokinetic dynamometer is there. So these are the machines which are basically useful for rehabilitation as well as angle specific training for the players. And another one, so let's focus into the eccentric training, as I have already said. Why eccentric training is important? Because eccentric training is the one which basically utilized most of the time during the sports. And hence, eccentric training is also basically used by many of the coaches, especially if they want to target for hypertrophy in strength training. Why this is so? One basic concept, that is the force into velocity relationship. If you see this graph, this is the this is the force and this is the velocity. So what is happening in case of the eccentric training here? Eccentric training, what is happening is, eccentric training, the force of the force of the muscle contraction will increase when you increase the velocity. For example, in case of the concentric contraction, what is happening? The force of the contraction will is inversely proportional to the velocity. That means if you slow down in lifting a particular heavy weight, then you will be able to lift that particular heavy weight more easily. Why? Because you are able to produce more force. So this concept is being used in case of the training. Because if you do eccentric training at a very high velocity, then what will happen? Very high force will be there, and this might causes rupturing of the muscle, or injury may also happen. So this concept is important. Or suppose if you want to do strength training in a gym for targeting hypertrophy, we generally prescribe the eccentric component at a very slower velocity. Why? Because we want to maintain that particular tension for a longer time, as well as decrease the chance of the injury. And strength training is important. Why? Because this eccentric is very important. Why? Because it is the basis of the stress shortening cycle, or we call SSC. SSC is very important, where eccentric component is there, and after eccentric component there is concentric muscle contraction is there. So this is an example of the SSC cycle, or plyometric exercise. It is also known as plyometric exercise, where we basically, if you see here, counter movement jump, and what is happening is, the person is, before dumping, he is just bending his knee so that there occurs eccentric or contraction or stretching of the quadricep muscle. Then what is happened after that? He just jump in the air. That means contraction of the quadricep it's happening. And the importance of the plyometric exercise is that if you do a concentric exercise after the eccentric exercise, then the performance of the concentric exercise will be increases. So that's why this concept is very important. But unfortunately, eccentric training also has many problems, like injury. The chance of injury is very high. Why? Because the force production is very high, as well as DOMS. DOMS is delayed onset muscle soreness, where after doing some exercise, after 24 hours or 48 hours, 1 to 2 days, you basically feel some muscle soreness or pain in the muscle if you do unaccustomed exercise. So this is known as DOMS, and DOMS is basically happen after you do eccentric exercise. So eccentric exercise may be good for hypertrophy. It is important for the sports performance, but it will but injury may also happen. So this thing which you have to remember. So next, going to the principle of the strength training, how you are going to prescribe as a strength training when suppose a player comes to you. Before going to the the detailed structure of the strength training, you have to know the principle. The principle is, yes, I already told that we measure intensity of the strength training in the form of the RM. RM, this one RM means repetition maximum, only once time. The person is able to lift only one time. So 100% one RM will be your supra maximum, that is the maximum limit which you are able to lift. So depending upon the gradation of the 1 RM, the exercise intensity can be graded: high, moderate, mild. This is we already discussed. Another one is, instead of the using percentage 1 RM, you can use the number of the repetition also. Suppose if you are able to do more than 20 repetition in a go, in an exercise, if you are able to do more than 20 repetition, then what is happening? Your intensity of the exercise, the weight which you are using for exercise will be relatively lower as compared to less than 2. Why? Because if you are able to lift only 2 times, that means weight must be very, very high. So there is the inverse proportionate relationship between what you call the number of the repetition which you are able to perform and the intensity or the weight of the which you are able to lift. So depending upon what type of the strength training, what type of the strength adaptation you require, your training can be designed accordingly. Suppose if I want to focus more on muscle hypertrophy, suppose a person comes to you and says, "What's up? I want my muscle to be more hypertrophy." Then this is the range. Approximately in this range, you can give your exercise. The exercise should be such that the repetition should not be very, very high. The repetition, the ability to repeat the exercise should not be very high or should not be very low. It should be in medium. So in this way, the strength training can be specified to the requirement of the particular individual. So just by knowing this concept, I am just telling you the rule of thumb. This may be useful if you design a particular exercise program depending upon the requirement. And the one important point which we already know regarding the exercise training is this principle of the specificity. Yani you have to give specific type of exercise for the specific adaptation. SAID, specific adaptation to the induced demand. This is very important. And another important point is principle of the individuality. Each person is different. So if you give the photocopy of this training regimen to everyone, then everyone will not respond to the same thing. That's why individuality is very important. And this table which I have given is just a rule of thumb where you can modify depending upon your requirements. So let's go into the details because this slide is important. All strength training is the basis is in this slide itself. Suppose if you want to improve the strength, what do you mean by strength? Strength is nothing but the maximum force capability of the producing maximum force by a particular muscle or group of the muscle only one time. That is strength. So strength is basically the force, maximum force. And what is power? Power is nothing but the ability to do work rate. That is ability to do particular work in a particular time interval. That is, if you consider work as well as time, then power will be there. Or if you consider force, then velocity has to be considered. That is, force into velocity is the power. That is ability to produce force in a very high velocity. This will denote your high power. So that is power. And what do you mean by hypertrophy? We already know that if you bulk up the muscle, the strength training is very important. And what type of the strength training, depending upon depending upon different prescription parameters, then you can set your muscle to have the hypertrophy. Another one is the endurance. Suppose you have to know difference between two things: cardiovascular endurance and muscular endurance. What I am talking here is not cardiovascular endurance. What I am talking about is the muscular endurance. Muscular endurance means ability to contract, sustain, ability to have a sustained contraction, or ability to do submaximal contraction for a longer time. That means you are able to do your exercise or contraction for a particular longer time. That is your muscular endurance. What do you mean by cardiorespiratory endurance? Cardiorespiratory endurance is different, where your ability to do for a longer duration run, longer run for a runner, for endurance training, that concept is different, where VO2 max is used there. So here we are basically focusing on the muscular endurance. So if you want to target the strength component, and your exercise prescription should be such that it should target near your maximum capability, that is 1 RM, that is 85% of 1 RM. That means your weight, the amount of the weight which you will be lifting has to be a little bit higher, and it has to be performed for a repetition of 6 equal to or more than 6, and the set, and how many set? 2 to 6 set. That means 2 to 6 set of exercise comprising of the at least 6 repetition can be done in order to target the strength. but you have to give a particular rest. Why? Because if you do a relatively higher load with a relatively little bit, repetition, then fatigue has to be there. So fatigue has to be, minimized. So rest interval has to be given. There is 2 to 5 minutes of rest interval between the set can be given. This is for what you call strength training. If you want to do a power, same again thing, A and B, these are the different sources, and depending upon which book or which reference or which author or which practical knowledge which you are referring, you can use either. Another one is a power. If you are doing a single effort event or a multiple effort event, the power prescription differs. Suppose if I want to do a single effort, then I will be targeting about 80 to 90% of the 1 RM. That means my what you call, if my 1 RM is 100 kg, then I will target 80 to 90 kg. The repetition should be relatively less, 1 to 2. Why? Because you have to power is speed into force. Force speed has to be there. Speed can happen only when if you little bit reduce a load. So that's why if the load is 8 to 90%, then repetition has to be little bit reduced, 1 to 2, in order to avoid the fatigue. The set exercise set may be 3 to 5 times, 3 to 5 set of 1 to 2 reps exercise, and the rest interval can be 2 to 5 minutes. And suppose if you want to target hypertrophy, then what will you do? Hypertrophy will be approximately in the middle, like I have said. In the middle, that is 67 to 85% of your RM should be there. And the repetition for approximately 6 to 12, exercise repetition. And this repetition should be done in a set of 3 to 6, and with a rest interval of 30 to 60 seconds. Why rest interval is less? Why rest interval is basically here? See, rest interval is basically less because you want to have your fatigue into the play. Because hypertrophy can happen under 2 conditions. One is you have high mechanical load. High mechanical load can happen when you do a eccentric type of contraction, or if you do a higher load, if you do a longer rep. And another one is if you have a cardio, circulatory load, where that can happen if you reduce the resting interval. If you reduce the resting interval, your fatigue will be there, and that fatigue is because of the loss of chemical messenger will be produced in the muscle. That chemical messenger will help you in the hypertrophy of the muscle. That is the chemical mediated or circulatory mediated basis of the hypertrophy. That's why hypertrophy has these 2 components. Another, if you want to do an endurance, training, then endurance training, you have to perform it for a longer time. If you want to perform for a longer time, then your load should be relatively less. That is less than 60%. It has to be only if the load is that, then only you will be able to perform for a longer time. That's why load will be less. Repetition has to be higher. Repetition high, and rest interval can also be lower, because what is happening in the what you are training your body is, you are training your body in order to resist the fatigue. If fatigue is there, you will not be able to perform for a longer time. So if you train your body in such a way that if you are able to resist the fatigue, then what will happen? Your endurance time will be. So that's why the rest interval is relatively less. So depending upon the physiology, if you know the physiology of underlying mechanism, then you will be very easily able to prescribe, what type of the strength training depending upon a goal. And this is very important. This has to, every coach has to know this thing. And we already know that there are 2 types of the fiber. There are lots of type. Intermediate fiber is also there, but for practical purpose we are considering only here 2 types of fiber, type 1 and type 2 fiber. We already know this from our basic classes. Type 1 fiber is basically for endurance related, your fatigue resistant, you are able to do activity for a longer time. But unfortunately, type 1 fiber has one limitation. It is not able to produce force for a very longer time, very much higher force. For that, type 2 fiber has to come into the play, because type 2 fiber has a capability of producing more force is there. In strength training, what we are targeting is higher force. So we are targeting type 2 fiber. But the type 2 fiber has another problem. It has a very high threshold. That means the type 2 fiber will be recruited only after type 1 fiber is recruited. This is known as Handman's size principle. So if you want to target directly type 2 fiber, then you have to do something in order to avoid this high threshold. how it can be done? It can be done by modifying your physiology depending upon your knowledge. Why? Because the type 2 fiber recruitment also increase in case of the fatigue. If you do exercise even with a lower load to the fatigue or to the failure, then what will you do? You will target the type 2 fiber in spite of the fact that you are using very lightweight, because lightweight is basically for type 1. So by using just fatigue, you can target type 2 fiber. So, and another one is, just if you restrict your circulation, then what will happen? Circulatory load will be high. So circulatory load, because of the higher circulatory load, you will be able to target type 2 fiber even if you use lower weight. This training is known as blood flow restriction training. So everything is physiology. Everything, every sport science manipulation, everything can be done only if you understand the deep physiological basis. Okay, so another one, let's same thing. This is the same thing which I have already spoken. One RM and repetition inversely proportional. If repetition is high, RM has to be low. Same thing, everything. They are all inversely proportional. And if this is also same thing. And if you want to target strength gain, then what will happen? Your intensity has to be higher. That means you have to know strength is nothing but a maximum force. So maximum intensity has to be here in order to have a strength gain. So this is just the basic concept which I have already told you. And another one, many of the people ask is, what is the difference between a free weight and a machine? Because loads of the machine has come. The important point of the free weight exercise is free weight not only target that particular muscle, but it also target the whole other body, because your other muscle has to come into the play in order to maintain your posture, in order to get particular correct movement pattern and all this thing. That's why free weight training is, we always prefer free weight training. But here are, because the advances in technology is such that many of the machine-based strength training has also been developed, which mimic a particular sport. Like this is a javelin thrower. So in this way, and also machine can be used when we rehabilitation, when a particular person is injured, and when when we rehabilitate that, we don't want to undue pressure in other blood. That in that condition also we can use what you call the machine weight. So, and another point which I want to focus is, if you do strength training has to be done throughout the range of the motion. Then only muscle growth will happen. Otherwise, muscle growth will not happen. Suppose if you see here, if you do a shallow squat, then what will happen? The increase in muscle strength, muscle growth, muscle hypertrophy will not be very high as compared to deep squat. Why deep squat? Deep squat means what you are doing is you are doing full range of motion training. So full range of motion training is very important. Another what people usually do is they usually cheat it by if they do higher weight, then they will not be able to perform for a full range exercise. So why this is happening, I will be explaining in a further slide. But the important point what you have to know is you have to do full range of exercise. Okay. Another one is a sequence of exercise. Rule of thumb, 3-4 points, which you have to remember as a coach. What you have to do if you want to, sequence of exercise. Number one, complex exercise involving larger muscle group, exercise involving multi-joint has to be done first. Otherwise, the injury may happen, and proper recruitment will not happen. So exercise which are fatiguing in nature, number one. Number two is focus large muscle group. Number three, which are multi-joint, has to be done first. Because depending upon the exercise pattern, your ability to do perform exercise depends. Suppose if you see this slide, what we are doing is we are performing first bench press, then you are performing what, leg press, then what you are doing, you are doing shoulder press, then what you are doing, bicep curl, and what you are doing tricep extension here in this manner. So if you do bicep bench press first, then the last exercise, that is tricep extension, you will not be able to perform much of the repetition because of the fatigue. But if you reverse the sequence here, if you first do tricep extension here in this second, tricep extension, then bicep curl, then shoulder press, then leg press, then bench press, then what will happen? Your ability to target, your ability to perform your bench press will not be as much high, as you perform in this sequence, because see here, you can see the reduce in number of the repetition. You will not be able to perform it because of the fatigue. So that's why sequence of the exercise is very important. If you want to target a muscle which is basically because of the which is basically perform in case of the bench press, then you have to perform the bench press first. Otherwise, you will not be able to do bench press properly if you do bench press as a later sequence of exercise. This is very important. Another one is sometimes what is happening. This is a general rule of thumb, but sometimes some of the players or some of the coaches which are more elite player or which want to do more hypertrophy, what they are doing is they just reverse the sequence. They usually perform their exercise which target that particular muscle, that is multi-joint exercise, later, not first. So single joint exercise will be done first, and then multi-joint exercise can be done later. Only in a certain condition, that is known as pre-exhaustion. What is pre-exhaustion concept? Pre-exhaustion is if you do a single joint exercise like tricep extension, suppose, tricep or bicep curl, first as compared to the bench press, which is a multi-joint exercise, then what will happen? You will fatigue. You will fatigue the muscle which is happening here in bicep and tricep extension, which also participate in bench press, like tricep muscle have participate in both. And because of the relatively fatigue of the tricep muscle, when you do bench press, then what will happen? You are doing more stimulus, more fatigue stimulus, giving more fatigue stimulus to the muscle. So what will happen ultimately? Your type 2 fiber will be recruited, because type 2 fiber is also recruited by fatigue. So if you able to recruit type 2 fiber more easily by just doing the reverse, then what will happen? Your chance of hypertrophy will be higher. So in this way, some of the people also do the concept of pre-exhaustion, but this is not generally prescribed. What we generally prescribe is always in this sequence. So let's go into the physiological adaptation. What are the physiological adaptations? If you do strength training, the physiological adaptation may be, strength and power, endurance, neural adaptation will be there. So if you do exercise for a first, 6 week or so, that is 4 to 6 weeks or so, then your gain in muscle, gain in strength will be because of your neural adaptation. Because muscle performance depends upon two factors. Number one is muscle itself. Another one is the neural factor, because neuromuscular is the one which is responsible for the strength. So first adaptation happens to the nerve, and then what will happen? The gain in muscle, hypertrophy will happen later on. And just like what I have already told you, different exercise may target different the component of the strength training differently. Suppose a body weight exercise may target the hypertrophy. If you do plyometric is mostly, we are targeting the power factor, where eccentric contraction is there. Same way, plyometric, eccentric plus concentric. If you only do eccentric, then it can be used for all. Hypertrophy is it can be done for by using eccentric. So in this way, like kettlebell training, you can target more power. So in this way, you can all exercise can be permutation and combination by using different exercise can be prescribed depending upon which strength component you want to target. So this is strength training. Another point which basically people usually ask me is, since our fiber type 1, type 2 fiber, they are genetically determined. Is there any possibility that we can change the fiber type by using certain training? The answer is yes, there is some possibility, but it is not so important. That's why instead of focusing on alteration of the fiber type, we should more focus on the proper technical training. If it is there at all, then it should be only less than 10%. And the sequence should be, type 2X fiber can be converted into type A, 2A, or type 1 fiber can be converted into type 2A by using high intensity resistant training. These are experimental research based thing. But for practical purpose, it is very, very less. Fiber type transition, it will be very, very less than 10%. And this strength training is absolutely important for the players as well as general people. Why? Because the amount of the reducing risks of the injury is highest in case of the strength, 69%. So if you do strength training, then not only it improves your performance, also it decreases your chance of the getting injury. And another one which I want to focus regarding applied aspect of the strength training here is regarding the concept of the strength curve. What do you mean by strength curve? Suppose if you are doing a bicep curl here by using a dumbbell, what is happening is if you do a bicep curl, and depending upon the angle of the elbow joint, your ability to produce force will be different. Here, this is the isometric force, and this is the angle. So depending upon the angle, a particular angle that is approximately 90 around elbow 70 to 120 degree angle, your ability to produce your force by the muscle will be maximum. This is known as strength curve. Strength curve. What is strength curve? Strength curve is nothing but the difference in the dependability of the isometric force or the maximum strength depending on your angle of joint. That is known as strength curve. So different, the muscle has different, optimum angle where you are able to produce more force. What is the applied aspect? Applied aspect is there. Some of the strength curve will not be like this inverted use. It can be, for example, for multi-joint exercise, the strength curve will be like this. It is known as ascending curve. Why ascending? With increasing range of motion, your ability to produce force will be higher at the end of the range of motion exercise. Before starting of the exercise, your ability to produce force will be relatively less. Let's see one example, bench press here. Bench press is an example where ascending strength curve is there. So when you start the bench press where your weight is near your chest, then what will happen? Your ability to produce force is relatively less. But if you increase, extension of the elbow, then what will happen? As the weight goes away far from your chest, the ability of to produce force will be high. If you want to load the muscle at this point, and the amount of the weight which is there is fixed, it may not be able to load, the muscle at different joint angle. Then this can be solved by using simple technique like this chain hanging. If you hang a chain in the bench press, then what will happen at the starting point where your ability to produce force is very, very less, the whole weight of the chain will be supported by gravity. It will be lying on the ground. But if you increase your the range of motion at the end range where your force producibility is very, very high, that means what will happen? The weight of the chain will be supported by you are lifting that weight of the chain. That means you are increasing the loading of the muscle at this point without undue stretching the muscle or undue causing the loading the muscle when the muscle is at least capability to produce force. This is important. This is the you must be knowing the principle of progressive overload, where you have to load the particular system progressively in a progressive manner in order to have a super compensation or in order to have a physiological positive adaptation accompanied with proper recovery. This is, we all know that. So the progressive, in order to have that particular loading, we generally use in this technique. Band also you can do in the same way. So the squat is also another exercise where ascending, this thing is there. So in the same way, another exercise is this thing which you have to know is some exercise has a descending one. Descending one. So at the starting of the exercise, just like the this is leg pull down or chin up or exercise. These are the example of the exercise where descending strength curve is there. So at the starting of the exercise, your ability to produce force will be very, very high. But if you increase at the near end of the exercise, then what will happen? Your ability to produce force will be less. So this is important. So what is the applied aspect? What is the practical aspect? Practical, just see this example. The particular person is doing this bench press. He is just lowering. Then what is happening? Rupture of the pectoralis muscle is happening. Rupture. And where the rupture is happening? At the point where weight is near the chest. At the point where weight is near the chest, where your muscle is able to produce minimum force. You are not able to produce the force. That's why injury is happening in this way. And hence the spotter, the one which is behind, he should be more careful when the weight is lower instead of weight is higher. So what he is doing is basically a little bit opposite. That's why injury is happening. So this is important. So again, yeah. Okay. So this is the Sai Bangalore. This is the isokinetic machine, like I've already told you, and this is the. Hello. Okay.
Yeah, I think some participant is just unmuted. Okay, you
Okay,
can
okay, no
carry on,
problem.
doctor. I'm
Okay, okay,
muted.
no problem. No problem. So this is the another example where I just made a custom made machine where I measured the strength curve, like by using, certain, dynamometer, by using EMG, electromyography in the muscle. You can easily find out the angle of the, elbow flexor and extensor. So we have applied patent for this, and this has been accepted as a learning practical for, future doctors, where training is being given to them. So this is the concept of the strength training which I applied in teaching also. Another important point, another important is the concept of the strength curve itself or biomechanics can be applied for training modification. This is a bicep curl, suppose, and bicep curl is basically our third type of the lever. This is the third type of the lever system. Physics, if you remember your physics class, then you will be knowing that there are first class lever, second class lever. This is a third class lever, third type of the class lever. So if you do a bicep curl, then what has happened? What is this? This is the axis of rotation. And this is the force. The perpendicular distance between axis of the rotation and angle of the force or line of the force, this is known as momentum. This is known as momentum. And the force into momentum is known as torque. Remember your physics lesson. Torque is the angular force, and the torque is equal to the perpendicular distance of the line of the force into axis of rotation into force. That is known as torque. So if you see the torque here, this is the force is same because you are holding a same weight. But this momentum is maximum at 90 degrees. That means if you are using a dumbbell, then the torque will be maximum here. Torque is nothing but the angular force. Each and every every bony segment in our body, they follow an angular motion. So torque is maximum at this 90 degree. That means at 90 degree, the amount of the force acting, external force, will be maximum at bicep at this particular, if you're doing a bicep curl. So this is another important. But if you want to change that thing, then you can always use by using a pre-circle. What is pre-circle? You just modify your bicep curl just by adding these bands, declining bands. And what will happen? What has happened? See, the line of the perpendicular distance between axis of rotation and your external force will increase. That means when you are extending your elbow at that time, your torque will be maximum instead of at 90 degree. So just by knowing this strength curve, just by knowing some basic physiological biomechanics, you will be able to modify your exercise so that you may target differentially the muscle at different angle or at different range of motion. This is very important. So another one which we generally use is EMG based application. EMG is nothing but electromyography. What is electromyography? What we are doing is in electromyography, we just apply electrode to the muscle, and this is fit to a particular analyzer, and we just see what is happening, what is the recruitment or what is the activity of that particular muscle. Like suppose if you see here, flywheel curl is there. In the flywheel curl, we can see that by using this electromyography, we can see that which particular muscle is activated more. Suppose in case of the bicep femoris, medial head of the bicep femoris is more activated as compared to proximal head. In this way, you can know which particular exercise causes which particular segment of the muscle, by using EMG basis. So this is just, I just want to let you know what are the things which is happening currently. That is, biofeedback training is also currently happening. In the same way, by using EMG, we can say that in the bench press, when you're doing bench press where a pectoralis muscle and your deltoid muscle is working, another important muscle, that is your infraspinatus, or which is one of the four muscle of the rotator cuff. The rotator cuff muscle is also acting. So if you have a rotator cuff injury, then what will happen? Then you may have possibility of shoulder impingement, shoulder pain problem may be happen, and your performance of bench press will be reduced. That's why knowledge of feedback, biofeedback, training, and knowledge of this differential activity of the particular muscle activity during different type of exercises is very important. In the same way, If you do, bench press, if you can do incline, bench press, or you can do decline bench press, or you can do flat bench press. So depending upon your incline or decline, then you can target different muscles. Like deltoid, you are targeting more deltoid if you're using incline bench press. But if you are using, decline bench press, then you're targeting more tricep and pectoralis measure. So in this way, this is very easy and very easily understandable, but highly neglected area of basic physiology, which everyone must know. Another one is a deep squat. Depending upon angle of the deep squat, you will be forcing lot on different parameter. Like suppose if your squatting is around more than 90 degree, if your squatting is more than 90 degree, then you are maximally targeting your gluteus muscle, buttock gluteus. And if you're targeting around 10 to 70 degree of the flexion of the knee flexion, then you are targeting what? Hamstring muscle. So in this way, this is very important. In the same way here also, barbell where if you're doing this this type of the barbell, then you are morely quadricep dominant, you are morely focusing on your quadricep, and if you're doing this type, then it will more focusing on your hip muscle. So in this way, training is very important. Another one is depending upon a food poison. If you want to do exercise for in order to develop your gastrocnemius, your calf muscle, so if you position your foot like this, then what will happen? You are targeting more what? You are targeting more medial gastrocnemius. If you want to target the lateral side of the gastrocnemius, then your foot must be turned in if you when you are doing your calf muscle exercise. So in this way, by knowing this basic concept, by knowing this basic physiology, you can do rehabilitation, you can do target different exercise for different performance gain. Okay. So another important point, which basically many coaches and many doctors or many sports scientists are saying, whether strength training is contraindicated for children, because there is always possibility of injuring the growth plate. If growth plate injury is there, then there may be stunted growth will be there for the children. All these things. One point is strength training is not contraindicated, but it should be done under a guidance and it should be properly done. Like for example, less than 7 years, we generally introduce there is no little weight should be done. And only when the person is more than 16 years, then we entered, we generally enter into adult test program. In between, we focus more on the technique. Here, technique has to be very important, because without the technique, injury will happen, and it may result in different condition, like it may be apophysitis may be there for osgood-Schlatter lesion, pain may be there here, or syndrome Larsen-Johansson syndrome. These are different condition where because of the jumping or because of the differential excessive loading of the muscle or attachment of the tendon to the bone, this condition happen. In the same way, for example, if you are targeting the running also, the marathon is generally we target only after equal to more than 18 years. Before that, we generally focus on less than what you call 42 kilometer run. That is half marathon. We generally focus around 15 to 16. That's why what I want to focus is you have to know the proper technique. Proper technique is very important. Why proper technique is important? Because without the knowledge of the proper technique, injury will definitely happen. Like suppose, and if you know the technique and if you know the physiological behind the technique, you can little bit modify the exercise, in order to target the particular or different muscle or particular muscle in a differential manner. Like suppose if suppose let's see this diagram here. What is happening is, see, turning of the this buttock is happening. This is known as butt wing. This is very common abnormality, and this may be because of your ankle. There is problem in the ankle dorsiflexor. Ankle problem may be there, or it may be because of the tight hamstring muscle. So if this kind of the technical issue happens, then as a coach you can just provide an exercise for stretching, for example, stretching of the hamstring, or stretching of the calf muscle, and a range of motion exercise for the ankle. This is just an example. In the same way, here for the squatting also, what you have to remember is good morning squats or certain technical problem may be here, where what is happening is your chest and your hip, they should go, proportionately in such a way that your chest should not be delayed. Here, what is happening is while lifting, the chest is little bit delayed. So in this condition, what you can do is you have to train the proper technique, and training of the proper technique comes with what you call decreasing load. So load has to be decreased. In the same way, if you want to do, if more stretching of a more, more loading of a particular thing, then you can modify the exercise. Now, like suppose if your exercise is here in this way, if your front squat is there, then you are targeting more knee. The knee will be stressed. If the particular person is having knee injury or knee pain, then you may be preferred to have this one, that is back squat. And depending on if one is having more spinal issue, back pain is there, or hip pain is there, then you may prefer this type of exercise. So depending upon the problem, you can design your exercise also. Because what is happening is most of the time, in the gym or when a player is given a strength training, it has been advised that your knee should not come in front of your toes. But this advice may not be right. This advice may not be always right. Because what they say that if your knees come in front of your toes, then maximum load or excessive load will happen to your knee will be damaged. So this may not be true, and this is not true. But there is again some stressing is always there. If knee comes in front of your toe, the knee will always be stressed. That is right. But up to 15 to 20 centimeter you can go in front of your toe without any having excessive load. So this is important. So by knowing this basic exercise training concept, you may be able to give more effective exercise with minimization of injury. Another one is back pain, whether strength training is bad for your back or not. Lifting problem, lifting injury, then disc prolapse, posterior disc prolapse may be there. It will cause impingement of the nerve root, and it will cause pain. So proper technique, as long as your technique is proper, you are doing properly, then back injury will not happen. In fact, this is a good exercise. Squatting and all these things are very good exercise for back. For core stability exercise is very good. So it may not be leading to the back pain. Provided the technique has to be right. So technique knowledge is very important, because what is happening is, if this is just the increasing the pressure which is happening here, that is at the disc. So suppose if the pressure is, if you are lying down, the pressure, if suppose the pressure is 25% in case of lying down, then it will increase. If you do bending, it can increase up to 220%. That's why back injury mostly prone happen at this point. If you are sitting, if you're rounding up your back, and if you're lifting in this position, then it may even increase your the pressure here. So enhance there is chance of injury. So proper technique, knowledge of the proper technique is very important. So but how you are going to prevent, or how you are going to protect your spine when you are doing your lifting? Breathing technique is very important. The breathing has to be done. This is a very simple diagram or very simple video where the breathing is technique is being shown, just like where you are doing breathing when you are going underwater. You are inhaling, then you are just going with your breath is holding your breath, and when you are up again, you just release your breath. What is happening is you are basically increasing the pressure here. The increasing the pressure, that is intra-abdominal pressure as well as the intrathoracic pressure. Why? Because if the pressure is increased here, then what will happen? You will provide more support to the spine. Your spine, the injury of chance of injury will be reduced. In a similar way, abdominal abdominal belt is being used when lifting heavier. Why? Because you are just supporting your spine. Okay, by using your abdominal support, you can just increase your abdominal pressure to a very higher extent as compared to no bell, and hence your injury will be protected. But there is one problem. if you don't know the proper breath holding technique, or if you do lot of breath holding, or if you do Valsalva maneuver in case of the in a player who is a novice player, or who is just starting, then many problems may happen also. Why? Because if you do a Valsalva maneuver is nothing but if you hold a breath while a forceful expiration is done. That is known as Valsalva. You are just breath holding. So if you hold a breath, it will support, no doubt support your spine. But what will cause? It will increase your blood pressure also. It may causes rupturing of the small vessels and epistaxis, bleeding may happen, or it may causes projectile vomiting. Vomiting may also happen because of the compression of your abdomen. Or and just after just after your exercise, then what will happen? There will be a immediate fall in blood pressure, and because of the immediate fall, if you release the weight, then what will happen? Your blood will not be able to reach in your brain, and you will have sudden fall may happen also. That's why breath holding and Valsalva, they are double-edged sword. One must know when to use, one must know when not to use, and how to increase performance without causing any injury. So this is the physiology behind, and this is one has to remember. And another point, another major main misconception is weight loss. Strength training is the gold standard to increase muscle mass. Everybody knows. But strength training, is it strength training advisable for fat loss? Fat loss is generally has been aerobic exercises, generally running aerobic exercise generally prescribed for weight loss. But this is and many people think that strength training doesn't causes weight loss. This is basically a misconception. Strength training causes as much weight loss, body percentage body fat loss or fat mass loss, visceral fat loss, as compared to the aerobic training itself. And why this is happening? This is because of the one particular concept in physiology that is known as EPOC. EPOC is nothing but excess post-exercise oxygen consumption. What is happening is just after exercise, after you exercise, what is happening is you are consuming more oxygen. Your breathing rate is higher. This is known as EPOC or oxygen death. Because of this EPOC, there are some research paper, or there are some things where the article which says that the EPOC is more in case of the high intensity exercise and strength training as compared to low or moderate continuous aerobic exercise. And since EPOC is higher, you are utilizing more oxygen. You will be burning more fat, because fat can only be burned in presence of oxygen. It cannot be burned in absence of oxygen. If you are utilizing more oxygen after your exercise, then what will happen? You are burning more fat. And another important point is strength training will increase your resting metabolic rate. Why resting metabolic rate? Because if you see this diagram, if you see, this is your daily energy expenditure by your body. If 100% is the energy expenditure by your body, then out of that 100%, your exercise will causes only 15 to 30% of energy loss. This is for sedentary people. This is not for player, but this is just to give a rough idea. And if you eat particular food, that is known as thermic effect of food, where your body is basically utilizing the energy to break down the food. It is only 10%. 10%. And this thermic effect of food is more for protein. That's why eating more protein is beneficial for weight loss. And 60 to 75% of your energy expenditure by your body is resting metabolic rate. So even if you do lots of activity, if you don't increase your resting metabolic rate, long-term weight loss will not happen. Weight loss means fat loss will not happen. Because the energy expenditure by your activity, it's 2 to 5 times, as your RMR, resting metabolic rate. But strength training, it increase the lean body mass, and lean body mass increase the resting metabolic rate. That's why strength training is more useful, if not, as compared to your aerobic exercise, because strength training will causes more RMR, more energy expenditure will be there. More energy expenditure means more energy negative balance will be there. So you can eat more food. So that's why a negative energy balance can happen, and fat loss will happen. That's why strength training is more important. It maintains your lean body mass. It will increase your body fat. That's why strength training is tremendously so important. Another important point, what people usually ask is whether we should do flexibility before strength training or not. This is important. Why? If you do a static stretching for a longer duration, that is more than 60 seconds, then your performance will decrease. Your power performance, if your sports is power based, then you should not do stretching before exercise. That is, if your stretching is more than 60 seconds. If it is less than 60 seconds, not much of a problem. That's why stretching is also, you have to remember whether you should do stretching or not before exercise. If your sports is performance based, strength based, then longer static stretching should not be done. But stretching should be done after the exercise. After the exercise, this is what we have written a particular handbook when I was working as a sports medicine doctor at SAG and ARC. And if anybody is interested, then I can share this book also. So what is the basic applied aspect of the stretching? Stretching can be done in such a way that it can be done in such a way that stretching should not cause any kind of painful. It can cause a little bit tension, but it should not cause pain. And it can be done before and after exercise, no doubt. But if the exercise is strength and power performance based, then it may causes up to 30% of performance reduction. That means strength training, mostly static strength training for more than or equal to more than 60 seconds should not be done before exercise if your sports is muscle strength and performance based. This is very important because static stretching has a more negative effect as compared to ballistic dynamic stretching. That's why dynamic stretching you can do, but static stretching you should avoid. And this effect is more in case of the lower limb. Suppose if your sports is more lower limb based, like vertical jump. So if your vertical jump will be reduced if you do too much static stretching. So that's why you have to know all this concept. But the stretching can be as a part of the warm up, as a dynamic stretch. Another point for strength training concept for applied aspect is regarding what is known as PNF stretching. I just want to introduce this concept because many of the coaches doesn't know this concept, but this is highly useful concept for rehabilitation as well as to increase the flexibility where the performance depends upon your flexibility, like for a gymnast or like that. This is known as PNF or proprioceptive neuromuscular facilitation. It is nothing but it depends only on two principles of physiology, that is autogenic inhibition and reciprocal inhibition. That's all. What do you mean by autogenic inhibition? If you stretch, what is happening is if you contract a particular muscle, then after that, if you stretch that particular muscle, then what will happen? More stretching is possible because the muscle is inhibited by itself. That is known as autogenic inhibition. Suppose here, let's take this example. All means contraction. If you want to stretch off this hamstring, if you do contraction of the hamstring, isometric contraction of the hamstring. Isometric means, what do you mean by isometric contraction? Isometric contraction is a contraction where the length of the muscle doesn't change, where the angle of the joint doesn't change. The person is holding the same, but he is just contracting the muscle. After that, you just relax it and your partner will stretch it. Then what will happen? More stretching will happen. This is known as autogenic inhibition or whole relaxed PNF type of stretching. Another one is a reciprocal inhibition. Reciprocal inhibition means when you contract the opposite muscle, then what will happen? Stretching will be possible in that particular muscle. Suppose if I want to do stretching of this hamstring, then what will I will do? I will do contraction of the quadricep muscle. Why? Quadricep muscle is the opposite muscle of the hamstring muscle. So if I want to increase the stretching of the hamstring, then I will do more contraction of the quadricep, and this more contraction of the quadricep will causes inhibition of the hamstring, which is known as reciprocal inhibition. And since the hamstring muscle is inhibited, you will be able to do more stretching, more range of motion is achievable. So this is also known as contraction, relaxed PNF stretching, or you can combine both. When you are combining both, it is known as hold relax with against contraction PNF stretching. This is very important. How you have to do this is a practical aspect where you hold for 10 seconds, then 6 second relaxation is given, then 30 seconds you have to stretch. That's all. Simple. So in this is the PNF concept of the PNF stretching, where you use the knowledge of the strength training and applied physiology in order to increase the performance. Another important point of the stretching here is the exercise associated muscle cramp. Here you see that. Sometimes what is happening is exercise associated muscle cramp is here. When because of the exercise, when you are doing, the muscle will be having so much contraction, involuntary violent contraction, that it will causes too much painful. So as a coach, what you can do, because you cannot just go and do injection or painkiller or something like that. You have to do, so based upon your knowledge of the physiology, you can easily treat this condition. This is known as exercise associated muscle cramp. What is happening is premature fatigue. If fatigue is there, then it will cause increased activity of the muscle spindle. There is something known as muscle spindle. Muscle spindle is the one which causes contraction of the muscle, and there it will causes inhibition of the Golgi tendon organ. Golgi tendon organ is the one which causes relaxation of the muscle. If it is inhibited, then what will happen? Contraction of the muscle. That's why, because of there is uncontrolled contraction of the muscle, and this uncontrolled contraction of the muscle is known as exercise associated muscle cramp. So if muscle cramp is there, you cannot just go and do some sodium or some electrolyte and say that he will be okay. It's not like that. Spinal or neural alteration in the activity is the responsible, not because of the dehydration or something. Dehydration may be responsible, but this is the main mechanism. So fatigue, you have to control the fatigue. But if see what she is doing is she is just doing stretching of the quadricep. So passive stretching is useful in this condition. Passive stretching for up to 20 minutes or till your contraction happens, then you have to maintain your passive stretching. If you do passive stretching, the stretching will causes increased activation of the Golgi tendon organ, whereas decreased activation of the muscle spindle, and this will causes inhibition of the particular muscle. Or you can do contraction of the opposite muscle. If suppose if you are having contraction of the quadricep, and what will happen? You will do contraction of the hamstring. If you do contraction of the hamstring, then what will happen? It will causes inhibition of the quadricep. So in this way, reciprocal inhibition can be used to treat this condition. Or there are different, or icing can also be used, and there are different other is the electrophysiological technique, which I will not go into the detail. But the basic concept is passive stretching is useful in this condition only, not before some power event. Otherwise, performance will decrease. So this is the applied aspect of the strength training. Okay. Same concept here we use for eccentric training. Why eccentric training is so much important? Like I have said, eccentric training can causes muscle problem, but eccentric training can also be useful, very much useful. When we use an exercise to treat a particular condition, then that is known as mechanotransaction. Exercise is causing repair of the particular tissue, damaged tissue, repair is happening because of the different mechanism, and that mechanism is known as mechanotransaction. That means exercise has the capacity to heal without using any kind of the medicine. You don't have to use any kind of the medicine. If you know proper exercise technique, then you can easily treat your patient. Suppose if you are having Achilles tendinopathy, or Achilles tendinopathy, mid-insertional Achilles tendinopathy, it can be healed by using eccentric training of the calf muscle, which is also known as heel drop training. Or if you have a hamstring problem, then what this is Nordic hamstring exercise is an eccentric exercise of the hamstring. This is very much important in order to prevent the hamstring getting strained. In the same way, if some adductor pain is there or adductor strain is there, Copenhagen adductor eccentric exercise one can use to minimize the risk of the injury. So in this way, this is important. In the same way, this was given by Janda. Janda was a scientist, which Dr. Janda, he gave this particular concept. Suppose if you are having neck pain, then what will happen? In the front of the neck, hip cervical muscle in the front of the neck will be weak, inhibited. That means you have to strengthen this muscle. And oppositely will also be inhibited, like your lower trapezius serratus anterior muscle will be inhibited. That means these two muscles you have to strengthen. Another is, but front muscle like sternocleidomastoid pectoralis muscle, they may be facilitated tightness. You have to stretch this muscle, and stretching will also be done to the upper trapezius or levator scapulae muscle. So in this way, just by using this muscle imbalance knowledge, you will be able to prescribe a particular exercise or to a player who comes to you because of the various pain. But this is just a rule of thumb. It may not be applicable. So it may not be like a particular person is having low back pain. Then what will happen? You have to focus on gluteus minimus, medius, and maximus exercise. Strengthening has to be done. Strengthening of that abdominal muscle, like transverse abdominal, has to be done. And stretching of the rectus femoris or iliopsoas muscle has to be done because that muscle is tight. In the same way, tightening of the lumbar extensor stretching has to be done. Lumbar stretching has to be done. So just by knowing this diagram, you can you prescribe a particular different type of exercise. Okay. And another important point for the strength training is regarding if a particular person has suffered a particular injury, suppose ACL injury is there, and he comes to you and says, "Coach, up, when should I go to running or when should I play to sports?" Then you have to know certain condition, like you can allow that particular person player when your the isometric strength of the hamstring and quadricep should be more than 70% of the uninjured side. So how you are going to measure this strength? By using a isokinetic dynamometer. Or your knee flexion range of motion should be 95% of the uninjured side. So these are the different based on the different guideline you can provide a particular person for return to the play. This is just one example. So in this way, different the examples are also there. Like suppose we all know that who are the footballer coach must be knowing that ACL rupture is very common among females. Females are very common. So if you know a particular exercise which can help you in preventing of that ACL rupture, then it will be very good fruitful. So this was an paper which were published on different neuromuscular exercise. This exercise is best for prevention. Like suppose if you see, this is the odds ratio for injury. If it is decreased, then the rate the possibility of injury will be very less. So if you see the lower body strength training, so lower body, if you increase the lower body strength training, the rate of the possibility of injury will be very less. That means strength training is very important. Another one is this blue one. Blue one is lending stabilizer. And stability training or proprioceptive training, lending training has to be there. So in this way, or you can do some plyometric training also. So in this way, depending upon what type of the exercise is beneficial for prevention of the ACL. So depending upon if you know this particular concept, then you can apply different exercise in order to prevent the injury. So I'm not going to details of all these things. So let's go to another practical aspect, that is delayed onset muscle. So madam, one problem, I can go on talk because you have to interrupt me when time is ready. Okay.
Sir, we do not have any specific time limit. Since your content is really good, I would request you, whatever slides you have,
because,
you can
yeah, no
complete
problem. Because from my side, I can talk the whole day. But the problem is,
no, sir, but I think the concept and the content is very good. So as in when you feel so, you can.
Yes. Okay, no problem. So then let me continue again. So delayed onset muscle soreness. What do you mean by delayed onset muscle soreness? When you are doing particular strength training, unaccustomed strength training, then you must be knowing that when you give training to a particular person, and after 2 or 3 days, that muscle will become so painful. That is known as DOMS, or delayed onset muscle soreness. It happens mainly because of the eccentric training, because eccentric training will causes more micro tear of the muscle. Small micro tear will happen. Okay. So how you are going to prevent your DOM? There are so many different techniques of prevention of DOM. Another is doing proper warm up and warm down. This I have already focused. How you are going to do warm up and a warm down. Warm down. Why warm? Not cool down. Why warm down? Because the warm down, the cool down part is so much important that it has been realized that you have to actively do it. That's why it is known as warm down, not cool down. So before exercise, you can do a mild aerobic exercise. Before strength training. So you can do light weight single joint exercise can also be done. Or dynamic stretching can also be done. And after exercise, you can do a mild aerobic exercise up to 50% of your VO2 max can happen. And how much is 50% of VO2 max? Just use the carbonate method to convert into percentage heart rate, and by using a wrist watch which can tell you your heart rate, you can easily prescribe that exercise. Another point which most of the people use, of the player, international player, is using this cold water immersion technique. Whether it is useful, or what does the science say? The science says that if you are doing strength training, if your purpose is muscle hypertrophy, then this is not useful at all. Why? Because of the ice. If too much ice is there, then what will happen? Ice will, it will prevent in the formation of the reactive oxygen species and inflammation. Some amount of the inflammation, some amount of the reactive oxygen species or exercise adaptation. If you inhibit that by using a certain drug like painkiller or certain drug like non-steroidal anti-inflammatory medicine, then what or vitamin C or some antioxidant, too much antioxidant is also harmful. Then what will happen? You will inhibit that particular chemical, which will causes the body to adapt to the exercise. Your adaptation will not happen. That's why if you do too much of cold water immersion, then what will happen? If your purpose is for power development, strength development, then it will causes attenuation of the muscle hypertrophy. Your muscle hypertrophy will be inhibited. If your aim is for muscle hypertrophy, then you can not do this water immersion for muscle strength. And but if your purpose is for strength, and then you can still do cold water immersion. Not much a problem. And for endurance training, not much a problem, because endurance training, after, if you do cold water immersion or if you apply too much ice after endurance training, then it will not cause much a problem. But if you do after strength training, then you have to be very cautious, because the muscle hypertrophy may not happen, and the adaptation to strength training may not happen if you do too much of cold water immersion or apply too much ice. This one has to remember. Okay. Another important point of the strength training, or which people usually ask before going to gym, is, should I do aerobic exercise first, or should I do strength training first, or should I do strength training before aerobic exercise, or should I combine aerobic exercise with the strength training? What should I do? This is known as concurrent training, concept of the interference effect. A particular exercise can interfere in adaptation of another particular exercise. Suppose if I do aerobic exercise, this aerobic exercise has a different, because body doesn't know how do the body know that your system know that you are doing aerobic exercise? Because by doing aerobic exercise, certain biochemical changes are happen, and because of this biochemical changes, body recognize that theek hai, the body is doing aerobic exercise. In the same way, if you do strength training for a strength training adaptation, what is happening is a certain biochemical parameter will be released, chemical mediator will be released, and by using that chemical mediator, the body will know that you are doing strength training, so adaptation has to be there. But the problem is that biochemical parameter interaction will happen. One biochemical parameter can interfere another biochemical parameter. This is especially true in case of the aerobic training. If you do aerobic training, the biochemical messenger of your aerobic training, mostly interfere with the biochemical parameter or biochemical messenger of your strength training, and hence too much of aerobic training will cause us problem in strength adaptation. So if your focus is strength adaptation, then you have to limit your aerobic training. But strength training, the biochemical messenger of the strength training doesn't have that much of effect on the biochemical messenger or aerobic training. Meaning, you can do strength training doesn't have that much negative effect on aerobic adaptation. Okay, so this is the important concept. So since interference effect is there, negative interference is there, you have to know, how you are going to proceed. So depending upon a goal, suppose if your goal is power development comes under strength training. So if your this is power development, and what will happen? You have to use aerobic training sparingly. That means you have to minimize your aerobic training. If you use aerobic training, the duration and intensity has to be reduced. Otherwise, your power gain will not be that much. If your focus is on strength and hypertrophy, if you want to do for bodybuilding, if you want to do develop strength training, then it can be used, but not as much as compared to aerobic performance, where you have to keep your aerobic training to less than 30 minutes or 3 times a week. If you take the ratio of resistance training to endurance training, it can be 2 to 3 times to 1%. That means if you do 2 to 3 times of resistance training, then you can do 1 time of endurance training. In this way, if you reverse this ratio, then your hypertrophy will not occur, or a strength, the problem will be there. But in case of the aerobic performance, not much a problem. If you do more of resistance training also, no problem for aerobic. Okay. So aerobic training has negative minimum effect of interference effect, and hence aerobic for aerobic performance you can easily do strength training. And for what you call the interference effect is more if you do running as compared to cycling. If you do high intensity cycling has a negative, less negative effect as compared to running in power and strength. So if your purpose is to develop power and strength, then you can do exercise, aerobic exercise. That aerobic exercise, preferably you do aerobic cycling only, and that also high intensity. And this should be the ratio. But if your aim is more in running performance, then no problem. You can do power training, hyper strength training, no problem. That strength training will not cause us too much problem with aerobic performance. The only thing with strength training can cause is increase in muscle mass. Since increase in muscle mass means you have to carry extra weight when you are running. So in that position, in that condition, it can have a relatively negative in that time. So this is important. So untrained person, this is what I told you. Hypertrophic training, for hypertrophic training, the resistance training is very good. If you do concurrent training means combination of the resistance and aerobic training done in such a way that strength training should be more. So that is the concurrent training. So concurrent training and resistance training has a no problem if you are aiming for strength and hypertrophy. But aerobic training, this aerobic training has a problem. But if you are focusing on aerobic only, then your training must consist most of the endurance training, that is aerobic training, and resistance training can be little bit less, no problem. And that your aerobic training can be substituted by concurrent training, where you apply most of the resistance training. Only resistance training is not advised, but resistance training combined with the endurance training, which is also known as concurrent training, is advisable for aerobic performance. Same thing happened in a trained individual also. This is for untrained person coming to you for a gym training. This is for a player who is professional player. In the same way, professional endurance runner like long, for example, the person who is doing marathon. Here also you can apply. He has to undergo strength training. Strength training is very helpful for that. But for a hypertrophy strength players, then you have to limit your endurance. Even if you minimize endurance training, or no endurance training should be given. Instead of endurance training, concurrent training, where you design your endurance training very much less, which is comprised of less than 30 minutes or 3 times a week of high intensity cycling, you can add on in case of the hypertrophy players. So this is another important for concurrent training. So fundamental point is depend upon your goal. If your goal is strength and hypertrophy, limit endurance training. If your goal is for endurance performance, no problem. So let's go to another one, that is the blood flow restriction training. I have already told you when I was explaining the Hensman size principle that type 2 fiber is very important, because type 2 fiber recruitment happens only as a very higher level when your force of contraction has to be very, very high. But the type 2 fiber has the more capability of hypertrophy, more capability of strength producing capacity. So for type 2 fiber, your training intensity has to be very high. So, but the problem is, if the particular person has recently suffered an injury, then what will happen? He will not be able to perform exercise up to that intensity. That means his type 2 fiber training will not happen. That means his tapering will happen. Detraining will happen because of the principle of the reversibility. Whatever you gain, you will lose if you don't maintain it. But loss, the rate of the losing will be less, of course, for a trained person. So that means for in that condition where injury happens, if by knowing the underlying principle of the physiology, if you want to manipulate, if you fool the body that you are doing high intensity exercise without actually doing the high intensity exercise, that will be very great. So this is the concept of the blood flow restriction training, where you are basically restricting the blood flow. What blood flow? Venous flow, not arterial blood flow. Arterial blood flow carry the oxygenated blood which is required for the muscle to contract. But the venous blood flow carries all the byproduct, metabolic byproduct of the exercising muscle, and it carries all the deoxygenated blood, it carries to the heart. So if you restrict, by using a band, just like this band, if you contract, restrict your limb in such a way that your venous blood flow is occluded, but not your arterial blood flow, you are still will be able to perform exercise. But since you are not letting your chemical mediator or metabolite, which is created because of exercise, to wash out from the body, that means more chemically load will happen to that particular muscle. That means the body will perceive as if you are doing more exercise. Why? More higher intensity exercise will causes more metabolite. But since you are doing light exercise, but because of you are constricting the vein, your whatever metabolite that is produced, you are not allowing to wash out. That means your body will think that that created metabolite will be because of the high intensity exercise, type 2 fiber will be activated. So in this way, you can fool your body just by manipulating your physiology and apply this particular concept for different training, where you use very light intensity of exercise and very short interval of time, and you can still be able to target your type 2 fiber and hence more hypertrophy and more strength gain. So these are the different applied aspect of the blood flow, where you can use rehabilitation. If atrophy is there, if a particular person is suffer from fracture, then what, without exercise, muscle atrophy will happen. So blood flow restriction can reduce the muscle atrophy, because if you are not doing high intensity exercise, then risk of injury will be very less. But still you are getting all the benefit of high intensity exercise. So high exercise. So in this way, strength training can be given by using this blood flow restriction training. And this is the paper which was produced, published, where Norwegian power lifter, they use this concept of blood flow, and they were successful in increasing the amount of the what you call the amount of the adaptation, muscular adaptation. And practical point of view, how you are going to do this blood flow restriction training, how much pressure you have to give. The amount of the pressure which you have to give, that is known as AOP, or arterial occlusion pressure. Arterial occlusion pressure, what is arterial or limb? It is also known as limb occlusion pressure. Arterial, what do you mean by AOP? Arterial occlusion pressure is the pressure where you 100% occlude your artery. Suppose my arterial occlusion pressure is 250 millimeter of mercury, suppose. That means if I apply pressure of 250 millimeter of mercury here, no blood will flow, vein or artery. And by knowing that maximum arterial occlusion pressure, I can advise the blood flow restriction training. For upper limb, 50% of AOP. 50% of how much? 250 millimeter of mercury, because 250 millimeter of mercury is my arterial occlusion. So you are not occluding your artery, but still you are giving some occlusion. That is 50%. So 50% occlusion is generally used for upper body blood flow restriction. For lower body, like the thigh muscle and all that stuff, 80% of the arterial occlusion pressure may be required because of the bulk of the muscle. And you can do, 20 to 30% of the RM, 1 RM is sufficient. You don't have to do like 80%, 90%, only 20 to 30%. And since you are doing light, you can do high repetition, and short rest interval can also be very short. And by just using this occlusion, you are able to perform, adapt better in a better way. Okay. So this is another applied aspect of principle of the physiology, where you can, just by knowing the physiology, you can manipulate it in a positive way. Another point for the principle of the physiology, manipulation depend upon this particular concept. So this is your body. Your body is doing muscle contraction. Okay. The muscle is contracted based upon the electrical signal which is coming from your brain. Okay, this is clear. So electrical signal from the brain, it will cause the muscle contraction. Here you can see that muscle contraction is here, and this electrical signal of the brain will causes muscle contraction. So this is the basic physiology. Muscle cannot contract without an electrical signal. Suppose if hold this circuit from here, from head to the muscle, if I stimulate somehow, then what will happen? even if without much if this circuit is too much facilitated, then without having much effort, then my muscle contraction will be very, very good. Because this part, if this pathway is facilitated, already facilitated, then what will happen? It will be more easier for your body to cause muscle contraction. So this principle is used in case of the post-activation potentiation. What do you mean by post-activation potentiation? Thus, post-activation potentiation is just like a warm-up. Before doing a particular exercise, suppose if you are doing a vertical jump, before doing a particular exercise, if you do a near maximum or high intensity exercise comprising of that particular muscle, then what will happen? Since that that high intensity exercise will use this pathway, so this pathway will be facilitated for a particular time, for few minutes, and immediately after, if you do a particular exercise which may be a requirement for your sports, then because this pathway is already facilitated, your performance will be increased. So this is the basis for your post-activation potentiation. So post-activation potentiation means like vertical jump, sprint, and upper body performance can be improved by using post-activation potentiation, where you do a particular exercise as a high intensity before doing your sprint or upper body performance or vertical jump. Before doing that, you just do a particular exercise, then you do that vertical jump and squat, then only your performance will be increased. This is different from warm-up. Warm-up is different. Warm-up doesn't have this concept of potentiation. Warm-up, we generally prescribe warm-up as a lower intensity, but potentiation we generally prescribe as a higher intensity. But fatigue should not be. If fatigue is there, then your next performance will be decreased automatically. So fatigue should not be there, but still high intensity exercise if you perform before doing that particular sports or perform particular exercise, then your subsequent performance will be very, very high. So this is the concept of post-activation potentiation. Okay. In the same way, if suppose by using an instrument available, if I directly stimulate my motor cortex, brain, then what will happen? Same thing happening. Why here in post-activation potentiation, I am using physiological enhancing by using exercise to enhance my performance. Okay, but I use an instrument that like TMS coil, transmagnetic stimulation, by using a magnetic field, or by using a transcranial direct current stimulation, by using a direct current. If I stimulate this particular motor cortex, then I would also facilitate this pathway. That means if I particularly stimulate this particular position, that particular muscle, and if I do a particular exercise, that exercise should be increased theoretically. And it has been proven also, and these are the marketly available instruments which are used just like your what you call the music which you use during your gymming time. And by using stimulation of your motor cortex, using different anodal or cathodial stimulation, this stimulation will causes increased performance of subsequent exercise. So this has been a topic of the research. Actual performance increments. Some research says that it increases. Some say that it may increase. So this is a future application where players can use to increase performance in a non-invasive way, because it doesn't cause much problem. There is no side effect, not because the current which is given is very, very less. So by using this principle, we can increase the performance. So, so sports performance is extremely dependent upon strength training. We already know that. The strength training is important for sports performance. Like this research was published in 2012, where they use strength training successfully to increase short-term as well as long endurance capacity of the sea. Strength training is required for strength performance. Nobody doubt that. But is strength training also required for endurance players like marathon runners? Indeed, it is required. And this paper was published accordingly. And they have used strength training to increase the performance for endurance player also, for different purpose. In the same way, strength training is for athletic performance is absolutely required, and this strength training is required for overall performance, not only for endurance player, not only for strength training, and not only for power athlete, but also for endurance player, and one should know that strength training is the basis of injury prevention as well as performance enhancement, whether the player belongs to strength category or whether the player belongs to endurance category. It doesn't matter, one has to use. And different, like isometric exercise, one can use, or dynamic exercise one can use, eccentric exercise training one can use. So different exercise protocol, it can be used to increase the sports performance. And there are lots of published paper which says that indeed there is increased performance. So one has to know, the coach has to know each and everything about strength training. There is no excuse for that. And another one, for general people, is strength training required? Absolutely, strength training is indeed required for general people, because if you see that, if you see what is happening is, if you see, with increasing age, your lean body mass will decrease. This is known as sarcopenia. What is sarcopenia? Sarcopenia is the decrease in skeletal muscle mass with aging. And if you have done strength training in your earlier days, then you can afford to lose muscle without actually losing muscle in your old age. So strength training is very important. Strength training has the capability to preserve all the muscle, and this muscle is very important because all the cardiometabolic health, like diabetes mellitus, like all the other problems, they are all because of the lack of the lean muscle mass. So strength training will preserve that lean muscle mass. Otherwise, lean muscle mass can decrease at a rate of the 3 to 8% per decade, per 10 years. After your 30 years, after 30 years, 3 to 8% per year decrement in muscle mass can happen. So strength training, one has to do strength training in order to preserve that. Otherwise, problem will happen. Diabetes, the person will suffer from diabetes and all the sarcopenic effect, all the bone losing problem, especially for menopause women. So all this thing is very important. And simply like grip strength, just by using grip strength, the person who is doing more grip strength has the more ability to lift longer. That means your grip strength is an important predictor for your cardiovascular mortality, the chance of dying. If the person is having less grip, that means his chance of dying is very, very high. So another test is a sitting rising test, which the coach can use for general people, where these are the different, when a person from standing to sitting and from sit down to again going up standing, and different score can be given depending upon, and this different marking can be suppose if the person is not able to stand at all from sitting position, that means irrespective of age, whether it is 5 years, 10 years, 12 years, doesn't matter, high chance of mortality, survival is very, very less, high chance of dying is very there. And if the low score is there, then 6 times higher chance of the all cause mortality. It may be because of anything. Mortality means rate of dying may be there. That's why your balancing as well as your strength capability is very important, and you should keep on doing your strength training. And it is not only important for the players but also for the general public. You as a coach, you as an exercise specialist, you as a strength and conditioning coaches, you has an important role to play among the general people also, not only for the players. And for that, you have to know what is the recommendation for strength, how much you have to do strength training. The basic idea is you have to do at least two times of per week. Just that's all, only 2 times. This is the minimum. You should always target for more, for at least 2 times a week of muscle building exercise comprising of major muscle group of the body, all the major muscle group of the body. You should do the strength training. For other type of exercise, it is given 150-minute of moderate to high intensity of exercise per week. So this is the general guideline, but the important point is strength training has to be given, and this is the guideline. If one wants to see into detail how much frequency of strength training one can do, it is at least 2 times, that is 2 to 3 times day per week can be given. How much intensity can be up to 60 to 70% of 1 RM can be given for novice, for the person who just started. For a experienced person, you can increase the intensity up to equal to more than 80%. So in this way, you can, for time, what is a no specific time of strength training can be done. You can do any time, no problem, but you have to do it. What type of the strength training? Strength training can be multi-joint exercise. Strength training can be single joint exercise. Strength training can be machine-based exercise. Strength training can be free weight exercise. You have to do repetition. How much repetition? Repetition can be up to 8 to 12 repetition per per set. One set may comprise of 8 to 12 repetition, or you can increase up to 10 to 15, or even 15 to 25, depending upon which one you want to target. Whether you want to target your muscular endurance, whether you want to target your muscle strength, whether you want to target your muscle power. And set also same thing, 2 to 4 set can be recommended for most of the adults. So in the same way, the strength training is very important for everything. It helps prevent arthritis, cancer, osteoarthritis, from cancer, from depression, from diabetes, from risk of falling, from hypertension. Extremely important strength training. And you can get strength training by knowing all these principles. Just by manipulation, it should be individualized person, but you have to give strength training. So, but the problem is with the COVID lockdown, many of the person, they are not going to the gym or not able to do outdoor activity because of the fear of the COVID-19. So one must know the effect of detraining. That is principle of the reversibility. If you don't maintain that particular exercise, then after some time you will be losing your adaptation. You will lose your adaptation. But the good point is, since because of your previous training, just a hypothetical example where this is a muscle fiber and this is the nuclei of the muscle fiber. This is a muscle cell nuclei. By using this strength training, lots of the new nuclei will be created. So if detraining is there, if you stop training, then what will happen? Muscle atrophy will happen. But since already too many nuclei are already there, so if you do retraining, it will be far easier for you to regain back whatever you have lost. That means the maintenance of the muscle adaptation, which you have hard-earned muscle adaptation, may not be too much. I mean, too much high. That means by using some minimum exercise, maintenance exercise, you will be able to maintain your muscle hypertrophy or whatever muscle adaptation which you have gained, in spite of without doing much of the exercise. So that's why your aim should be detraining has to be avoided. But your tapering, you can decrease your exercise. Tapering is nothing but decrease your exercise parameter intensity, exercise duration, exercise volume just before your competition, so that injury doesn't happen, or so that your performance may be increased. So before your actual performance, before your actual competition, you have to decrease your training parameters. This is as per the principle of the periodization. Microcycle, mesocycle, and macrocycle. So depending upon the period of the periodization, you have to do tapering just before the competition, where you decrease everything. But the tapering should not be such that it causes detraining effect or loss of whatever you have gained. And the most important point, what you have to remember for detraining is sprint and anaerobic speed and agility. They are the hard, the hard parameter to know. That means your body is able to maintain sprint and anaerobic capacity for a longer time in spite of decreasing in training. But if you are having that muscle strength, muscle power, your muscular loss will be there. If you stop training because of the COVID-19, then what will happen? Your muscle strength and power will be lost. Your VO2 max will lose. Your aerobic power will lose. But sprint and anaerobic power, or your speed and agility, will be maintained for a relatively longer time. So in order to maintain your, say, cardiorespiratory endurance, you have to do a minimum exercise. That particular minimum exercise, which may be for aerobic endurance, which may be around 70% of VO2 max for 3 times a week. If you do at least this minimum amount of exercise, then you will be able to maintain your cardiorespiratory endurance or VO2 max. Similarly, for the strength and power loss, you have to do a small amount of at least twice a week, of 30 to 60 minute duration, comprising of most of the muscle body of the body for moderate to high intensity strength training. Then you will be able to maintain this loss because of the detraining. So tapering has to be done. And for tapering, just before the competition, we generally do 4 to 28 days. It can be done. and the tapering is done in such a way that it will increase your strength gain. In spite of the reduction in your training parameters, your increase strength will be increased, and even your aerobic performance may also increase up to 30%. So how much tapering has to be done for this is just an example for a endurance type where you can decrease up to 2/3 times of your training intensity or frequency which you were doing previously. You can decrease up to 2/3 times. Hmm. If you decrease the training more than 2/3 times, then you will go into detraining. That means you will have negative effect instead of having this positive effect of the tapering. That's why, as a coach, you must know how much you have to, at least compulsory exercise should be given to the players in spite of the having this COVID lockdown, or in spite of the not able to go to outdoor and gym. So this is important. Another important point before finishing, what I want to focus is about the sports nutrition. As a strength training coach, as a strength and conditioning coach, you have to know basis of the nutrition. Nutrition is very important. Usually what we prescribe is around 1.2 to 1.7 gram per kg body weight of protein. This is daily protein requirement, which may be around 12 to 50% of total energy need of the body. It may be more. Even for a strength athlete, it may be even more than, sometimes it may be up to 2.3 gram per kg body weight also. So it depends. And you must focus on the complete protein, food protein, the protein which is coming from food. If you are non-vegetarian, then it is good, because non-vegetarian proteins are mostly a complete protein. But some of the if you do combination of the vegetarian protein also, it is also good. But the important concept was, you have to remember, is you have to focus on whole protein. Not whole protein is more important than individual amino acid. So whole protein intake in the form of whey protein, in the form of casein protein may be taken, or in the form of other protein powder can be taken, or in the form of diet can be taken. Amino acid, different, like branch chain amino acid can be taken, like HMB, supplement you can take, and creatine is another supplement which is mostly taken by the bodybuilders, which mostly taken before the strength training, which will increase the availability of the ATP phosphocreatine. So all this concept which you have to know, and also the when to take is important. That is, timing is also important. Like whey protein has an increased chance of the absorbability. That's why just after exercise, if you take whey protein, that is more advantageous. And since casein has a longer duration of absorption, if you take casein protein before you go to sleep, because after sleep is very important. Sleep deprivation will causes whatever you will attain will be lost because of the sleep deprivation. At least 7 to 9 hours per night of the sleep is absolutely essential for the players. Sleep deprivation, one cannot afford to have sleep deprivation. And during the sleep, muscle building happens. During the recovery, muscle building happens. So muscle building, that's why casein, if you take casein protein supplement just before you go to sleep, then it will increase in your muscle building, your recovery. It will help in recovery also in this way. So protein, which type of protein which you have to, you can take all type of protein, complete protein. Mostly complete protein is advisable. And how much to take, it depends upon a different factor. You can take up to 2.24 or 0.3, or just what I said, like 1.7 gram or 2 gram up to 2.3 gram, you can take, no problem. For a person who is having normal kidney function, increased protein intake will not cause renal failure or renal kidney problem. This is a misnomer that protein intake will cause kidney damage. It doesn't cause any kidney damage for a healthy person. And when to take is very important. Like immediately after training you can take, or you can take before sleep also. For creatine, what is the dose of the creatine? Dose of the creatine which we generally prescribe is around 0.3 gram per kg body mass. And it can be given up to 4 times per day during 5 to 7 days can be given. So, and for a maintenance, this is a loading dose. For maintenance dose, you can give up to 3 gram per day, or there is no need of the loading and maintenance dose. Also, you can just give depending upon 2 or 3 gram per day, just like that creatine. But the problem of creatine is creatine may causes increased weight gain. So for a person for a weight category sports like boxing and all that stuff, where weight category maintenance is very important, creatine may causes problem also. It may cause weight gain. and that weight gain may be because of the increased water retention also. Because and another important point is, approximately 1 gram of the glycogen may hold about 2.6 to 3 gram of water. So glycogen may hold that particular water. So if there is increased glycogen storage in the muscle, if your muscle is hypertrophy, and because of the increased storage of the water also, there may be increase in weight also. So this is one of the effect of creatine, which a weight category player has to remember. And there are so many supplements which are available market, but the rule of thumb which I want to say is, don't buy and use supplements which are not reliable, because supplement will contain unwanted substance which are banned by WADA. Doping, you may come into doping, because unintentional doping or accidental doping cases very, very high. And most of the time, whatever supplement which you buy from the market, they contain 10 substances which are not present in the level. If you see the level, it will not be written, but still it will contain. So be very, very careful. So that's why for supplement, when it comes to supplement, only one rule of thumb is, try to avoid taking supplement as much as possible. You try to take normal food, normal diet. You try to improve your diet instead of taking supplements. Supplement means you are supplementing your diet. It's not the measure. If your diet is wrong, then your supplement will not cause anything. So you must remember. For endurance, these are the supplements which may work. For strength training, these are the like creatine and high protein. They are strong evidence is there where protein intake and creatine intake is very important. Like leucine and branch and amino acid, they have moderate evidence. Like some people may take zinc, magnesium, aspartate supplement, also ZMA supplement, or all this booster herbal supplement, cholesterol, all these things. There is no evidence of them working. This is important. Another is testosterone and anabolic steroid. Ban, absolutely contraindicated. One should not go for that, because that is banned by WADA. So this is important. And nowadays, people are coming more into low carb diet, high fat diet, keto diet, and all these things. But one thing which you have to remember is, for keto diet to work, keto adaptation is important. Keto adaptation may take up to 2 to 3 weeks, or more than 2 to 3 weeks also. And there may be keto flu also. The problem may happen when you transition from your high carb diet to low carb diet. So you have to be very careful. It has to be done under a highly qualified person, a sports medicine doctor, or exercise physiologist, or a certified nutritionist or dietitian, sports nutritionist, or a coach which is certified in this field. Only under that guidance you have to do. Otherwise, problem may happen. Keto diet is the evidence are supporting the role of the keto diet for endurance player, but for strength players, for high intensity player, the evidence is conflicting. So I cannot say much regarding this. But the one point is very important. Keto adaptation is there, and keto flu may be there. If you directly use keto diet, then you may have problem. So one has to be very careful regarding that. But in the long term, effect of keto is good. Health benefit of the keto diet, especially for endurance, is very good. So going again to the marks and the exercise, because people usually ask that, Dr. Saab, should I use marks while doing exercise? Because nowadays exercise marks is mandatory by the government guidelines. But one rule of thumb which you must remember is, try to do exercise in a if you do a group exercise, you have to maintain a proper distancing and in a proper protected environment. If you do exercise, then you don't have to wear masks in that condition. But if you go and do exercise, without maintaining your social distancing and all that stuff, then masks may be required. And masks doesn't interfere. Most of the say that doesn't interfere up to mild to moderate exercise you can do in normal healthy individual. If the particular person is suffering from some illness, then using mask is not recommended at all. For a normal healthy elite individual who are well adapted, then masks may be wear without having any problem for endurance like cycling or running or jogging, up to mild to moderate. For a severe exercise, then masks may have some problem. But again, some of the paper which has been published says that Even if in case of the for higher intensity exercise also, marks doesn't cause much problem, but you have to remember it may cause. That's why wearing marks may be done for endurance event in mild to moderate intensity, and if you are in a safe zone, you don't have to wear marks. This is important. Okay. So short arm moderate strenuous aerobic exercise with marks is feasible. It can be done. Safe, associated with minor physiological problem like your oxygen saturation will not be drop down. You don't have to worry about that. And there are certain marks which also come, like this is known as what you call the hypoxic marks are available in the market, but you which mimic the high altitude training. But you must remember that hypoxic marks are just marketing gimmicks. I mean, they don't work at all, and you don't have to waste your money for such a marks, because many paper has published which says that up to now available hypoxic marks are not at all causes adaptation, required adaptation, just like your hypoxic environment. And in fact, it may decrease your repetition to squatting and leg press. Yani your resistant exercise capacity may be decreased. You will not be able to do much exercise if you do hypoxic exercise. So this is you have to remember, because it increases the stress and rate of perceived exertion. You will be perceiving more exertion in a lesser intensity of exercise, and hence it failed to induce hypoxic environment. That means hypoxic in high altitude training, because sometimes high altitude training is used. But for as far as strength training is concerned, high altitude training is not much of use. High altitude training we mostly use for endurance performance. That to up to some extent. That means the concept of the living high training low. That means you live your condition, hypoxic condition should be in non-exercising duration. And but when you do exercise, it should be normal. Oxygen should be normally available. That's why instead of doing high intensity, high altitude training, hypoxic chamber are nowadays useful, where you can do lift high, low train. Why? Because if you train at a hypoxic condition, muscular negative effect is there. Muscle has a negative effect. You will not be able to train as much in high altitude as you are training in the lower ground, because of the lack of the oxygen. And due to that, your muscle atrophy will happen. Your muscle adaptation will not happen. So because of that, strength training or strength adaptation is not so useful as far as high altitude training is concerned. So this is you have to remember. And and those marks which are available, which mimic hypoxic condition, is not useful at all as far as strength training is concerned. So this is another point which you have to remember. So okay. Sorry. Okay. So let me.
I just have to interrupt you, doctor. We have another meeting scheduled at 7:30.
Okay. No problem, sir.
If we can proceed towards.
Yeah.
Okay,
so this was the last slide.
Okay.
And so I am, since that was my last slide, and this is just the conclusion, which I want to say, where to inform to all our coaches, says that you have to remember the principle of periodization. Without periodization, nothing is possible. It's extremely important. And your training, everything has to be done in such a way that positive physiological adaptation should be there, and negative adaptation will not be there. Otherwise, overtraining will happen. Performance decrements will happen in spite of the increase in training, and this will lead to the performance, human performance improvement. That's why the physiology of the training is absolutely important. So thank you very much once again. Thank you for giving me this opportunity, and I have talked. I have taken a long time.
I'd like to especially appreciate you, Dr. Sharma, for your presentation. It's truly impressing, the preparation of the entire presentation, the content, and the way you have explained the entire thing. So we won't take questions, because I think your session was so informative and knowledgeable that, I had jotted down a few questions, but as time went by, all the questions were answered. So if due to time constraint, if any participant has a question, They can, I think, mail it to you if you can provide your email address in the. There are 1 or 2 questions, but I think if you can just put your email address in the box, they can mail you their
Absolutely.
question.
No problem.
So uh, with this, we come to the end of today's webinar. On behalf of the coaching section of the Sports Authority of Goa, I take this opportunity to thank all those who have directly and indirectly contributed to making this webinar on physiology of strength training a big success. I would like to specially thank our resource person of today, Dr. Hanjabam Barun Sharma, for conducting today's session and enlightening us with his knowledge and presence. We are thankful to our executive directors of BM Prabhudesai and director coaching Sir Bruno Coutinho for all their enthusiastic support and encouragement towards this program. A special thanks to all the participants who attended today's webinar. We hope the knowledge shared on today's program will go a long way in helping you plan and execute your coaching programs. The feedback form link has been provided in the chat box on Zoom and YouTube. So if you have not, please kindly fill in that, and we will send you your certificates on email within 8 to 10 days. Uh, Please do not, all those watching on YouTube, please do not forget to like and subscribe to our channel. We have a lot of other programs also coming up. So to be updated, please do like and subscribe. And this is me, Steffi Cardozo, Assistant Project Officer, Sports Authority of Goa, signing off for today. Have a great evening and thank you.
Thank you very much.